On one occasion when I went in to the doctor, I was told, this isn't your fault. You can't do anything about it. But I nearly want to think there is something. I need to know there is something I can do about it, because if I don't have control, then I've nothing.
You talk about control, you talk about wanting to be able to do something so that you feel that you might be taking your life under control again, that it isn't something that has just happened and you can do nothing about. You talked about diet, you talked about lifestyle, losing some weight. How can future doctors and nurses and pharmacists, how can they help you feel more part of the process?
I think including you in the decision making would be big. Referring you to nutritionists, to counsellors. I've never been referred. I've always done that on my own accord. I've never been referred to anybody. And I think that when you're in it, it's all about the medical treatment. It's all about the chemotherapy, the surgery, going in for your checkups. It's checking your physical health. But the mental health is nearly the more important. To me, I believe it is more important, because when you're at home on your own in the evenings or up at 4 a.m. in the morning when you're not sleeping, tossing and turning, it's the fear that's keeping you up, and it's not the medical side of it.
Thank you. So, for 6 months, you've been the woman with breast cancer. For 6 months, you've been the woman who's been having cancer treatment. How do healthcare professionals remember that there's that person with a condition rather than the condition sitting in the chair? How do we see you?
Well, just like that, as a person. I'm a person, I'm not a patient. I think treatment, I think dealing with people who've going through a diagnosis, it has to be person-centred and not cancer-centred.
Easy to say. And all the textbooks tell us to do this. And Audrey, you're quite right. But how do we do it?
I think you need to, like, I know the time people, when you go to see the oncologist, they don't have the time to give you, they've a busy day, they're meeting a lot of people who are all in a crisis stage like myself, but you need to just give a person time, ask the questions. I know they have their job to get on with and it's more medical, but I do think by just referring somebody on to speak to somebody afterwards about possibly, like, you're getting information, it's very complex, you're in a crisis stage, everything is going over your head, just to refer you on, if there was maybe even 2 days later when you get news, to maybe go home, sit with it, come up with questions. You're going to have a lot of questions, you're going to have anxieties, but speak to somebody, a next step, to speak to somebody who can talk with you about your actual feelings, your thoughts, and where your head is at.